To the doctors of BC, thank you very much for the opportunity to talk about healthcare. Healthcare in British Columbia is broken. We are in a crisis. No amount of money is going to solve the problem. We need to be looking at a new model in British Columbia. British Columbia is the second most expensive healthcare jurisdiction in the OECD nations, and yet on many measures we have the second worst outcomes, especially when compared to European models. So what we are looking to do in British Columbia is actually introduce a European-style healthcare system for British Columbia. Universal healthcare, so that it is paid for by the government, just like it is today, but it will be delivered by both government and non-government agencies. By doing this, the funding will then follow the patient as opposed to the system itself. It'll allow for more innovation, it'll allow for better investment, and allow for better retention and attraction of healthcare professionals that we need in BC.
Healthcare is front of mind for most British Columbians these days. What are your priorities for the healthcare system, and how can physicians help you achieve them?
Obviously, there has to be a hand-in-hand relationship between the physicians and government in terms of doing this. This should not be a top-down approach by government. This should be done working in partnership with physicians as we see through this transition that's needed in British Columbia.
If elected, what would you do to address the shortage of doctors and other healthcare providers here in BC?
Clearly, this is a huge problem in BC. We need to do more training, but that will take time. We need to look at actually purchasing training spaces from outside of the province, but that still takes some time. Over the short term, we need to clean up our ability to be able to get healthcare workers that come into BC into the system faster so that they can qualify to go through. That means we're going to have to work with the doctors and make some shifts in terms of how we go through that process for having doctors get into our system.
If elected, what would you do to help specialists tackle their waitlists and ensure patients have more timely access to consultation and procedural care?
There's no question this is a huge issue in BC. Too many people are dying on a wait list for diagnostic services and surgeries. So what we need to do is we need to make sure that we get the red tape out of the system. We need to dramatically reduce the administration costs and process in there to allow doctors and specialists to be focused on their patients as opposed to on paperwork. This will also help to free up on quite a wide range of healthcare professionals to be able to help. But most importantly, we want to be able to unleash healthcare professionals and specialists' ability to be able to deliver services. It doesn't have to all be done through the government system. This is why we want a system that can be delivered by both government and non-government services, so that there is that innovation that can happen, and specialists are much better in a position to be able to service patients that are needed.
How would you ensure that BC is investing the appropriate amount of money when it comes to healthcare technology and infrastructure?
I think, quite frankly, that the professionals have the best approach in terms of what is available and what is out there. The model that we are talking about will allow for that innovation. It will allow for that kind of investment. It doesn't have to all be done through government. Government needs to be purchasing the services, and we need to make sure that we purchase the services from wherever it can be provided so that we can improve our wait lists and get people to the appropriate services that are needed. So that technological investment is going to be critical. Government needs to be able to step up to the plate and be able to support that, but we need that innovation and drive from the entrepreneurs, from the healthcare professionals to be able to deliver those services for British Columbia.
What does your party intend to do to help healthcare in rural British Columbia, including emergency rooms, hospitals, clinics, and ultimately rural patients?
This is a huge issue, obviously. One of the things that we'll look at is we will pay for training for some doctors and nurses, and in return ask for a 5-year commitment to service in underserviced communities. Particularly these communities where we've had ER closures on a regular basis. We need to be able to get the professionals in there to be able to keep these facilities open. So this is going to be a huge focus for us as government in terms of how we make sure these professionals can practice across the province. But once again, it's about changing the model. Today, with the Health Professions and Occupation Act, with so many things that are going on in our healthcare system, I'm hearing from more and more doctors that they're burnt out and they want to leave British Columbia. I'm hearing from many nurses that they want to leave, they're burnt out. We need to change the model so that we can show that there is a better way to be able to deliver healthcare services in British Columbia, and it'll give us a much better opportunity to be able to, like I say, attract and retain those professionals we have, and then through incentives, trying to make sure that we have those professionals being able to deliver services right across this province, especially in small and rural communities. Thank you for the opportunity to say a few words on this today.